November is National Diabetes Month, and while you may be familiar with the condition, there are certain lifestyle changes and things you can do to lower your risk. Heather Walker with Hometown Pharmacy is here to share more. Heather, thanks for joining us.
Yeah, thanks for having me back.
Yeah, so Diabetes Month. What is diabetes? A lot of people know generally what the condition is, but kind of explain it.
Yeah, basically it's just your blood sugars are higher than normal, and that can be because you have type 1 diabetes where your body just doesn't produce insulin. It could be due to type 2 diabetes where you have insulin, but it's just not as sensitive to the effects of insulin. And then there's prediabetes, which is not quite diabetes, but higher than normal.
Okay, so that's interesting. How do you get diabetes, and then why is that a bad thing, and what does it mean for you kind of going forward?
Yeah, so there are a lot of different risk factors. Probably the top three would be age. The older we are, the more likely we are to get diabetes. Family history. If someone in your family has it, you're more likely to get it. And also being overweight is a big risk factor.
Definitely. So things to keep in mind. Now, why is this kind of a negative thing? But then also, what does it mean for you going forward?
Yeah, so the way that diabetes affects your body is it reduces the elasticity of your blood vessels and causes them to narrow, so it reduces blood flow. So really any organ in your body that is dependent upon blood flow can be affected by diabetes. And so a lot of times we think about eye disease and kidney failure with diabetes, but diabetes can also affect the heart, it can affect the brain, the nerves, the skin. Pretty much all our organs require blood, so if you're reducing blood flow, you can have negative outcomes.
Wow, so definitely important to be proactive about that before it happens. Now, what can you do to maybe reduce your risk factors, but then also possibly reverse?
Yeah, so the first thing, top of the list should be to reduce your sugar intake. So sugary sodas, candy, desserts. Doesn't mean you can't have that stuff, but just it should be limited. It should be a once in a while treat instead of a daily thing. But also reducing things like refined carbohydrates. So starchy potatoes, pasta, white bread, those things your body can easily metabolize into sugars, which then spike your blood sugar.
Definitely. And then Hometown also has things that you offer that can help too. Can you tell us about that?
Absolutely. So some of our stores offer a diabetes prevention program. These programs target people with prediabetes to help prevent the transition from prediabetes into type 2 diabetes. In some cases, people with prediabetes can actually go back to normal blood sugar levels through these programs that focus on increasing your activity, eating better, things like that.
Wow. So focusing on being proactive instead of reactive.
Absolutely.
Definitely important. All right, Heather, where can people find you guys?
On our website at hometownpharmacyrx.com and on our on Facebook and on Instagram.
There we go, hometownpharmacyrx.com. Thank you, Heather.
Thank you so much.